The exercise and rehabilitation program demonstrated and described in this videotape and any associated materials is based on principles of general fitness for persons afflicted with Gaucher's disease. The program will not be suitable for every Gaucher patient. Each Gaucher patient should consult with his or her physician or care provider prior to beginning exercise in accordance with the program. Each patient who exercises in accordance with the program is advised to monitor carefully his or her condition and to contact his or her physician or care provider immediately upon the occurrence of any unusual symptoms or physical developments. The materials are distributed by Genzyme without charge, solely for informational purposes as a service to the Gaucher community. Genzyme and the creators of the materials make no warranties or representations as to the suitability or effectiveness of the program. Moreover, Genzyme and the creators of the materials are not responsible for and shall not be liable with respect to any adverse events that may result from a patient's exercise activities conducted in accordance with the program. This video is titled Movement for Life. The exercises in this video will give you a comprehensive approach for well-being. As a result of doing the exercises, you may be more energetic and increase both your muscle tone and flexibility. In order to obtain optimal results, these exercises should be done 4 to 5 times a week. You should start to see and feel the results in 4 to 6 weeks. Gaucher disease can cause many medical complications. Some of these complications may involve bone pain, bone crises, muscle pain, joint stiffness, fatigue, osteoporosis, and an enlarged spleen and liver. These complications can also lead to joint replacements. If you're experiencing one or more of the medical problems just discussed, you might feel nervous about participating in this exercise program. Perhaps every movement you make hurts your body, or you may feel tired all the time. What you may not know is, by not exercising, you're making your condition worse. Your joints may become stiffer and your muscles weaker, resulting in muscle atrophy or muscle wasting. Also, you'll feel more fatigued because of the lower levels of oxygen going through your body. The key to this video is to exercise within your pain-free zone. When you exercise within your level, you'll learn that exercise can work for you. Please be patient and never force the movements. Throughout the tape, keep these 2 words in your mind: pain-free zone. Suzanne Krupskas, who will be hosting our program, has been on enzyme replacement therapy for 9 years. Lenny Van Pelt, her assistant, has been on enzyme replacement therapy for 8.5 years. He has been on Cerezyme for the last 3 years. This exercise videotape is sponsored by the Genzyme Corporation in conjunction with the National Gaucher Foundation. And now, here is Suzanne.
Hi, my name is Suzanne Krupskas. I am a physical therapist and I have Gaucher disease. The diagnosis was made in 1981 and I have experienced all the symptoms and complications you heard about, including multiple hip replacements. However, during the time I experienced all these complications, I always exercised. I followed a simple regimen which helped me to increase my energy, strength, and tone. It also improved my joint flexibility, improved my bone density, and lastly, it improved my self-esteem. I hope to encourage and inspire each of you to discover your own abilities and strength. Before we get started, I'm going to review some important factors. First, please consult your physician prior to beginning this or any other exercise program. Second, you must breathe correctly. During exertion, breathe out through your mouth. During relaxation, breathe in through your nose. Or, if it's easier, you can count out loud during exertion and breathe in during relaxation. Third, drink plenty of water to prevent dehydration and muscle cramping. Consume approximately 48 to 64 ounces of water daily. Fourth, stop exercising if you find the exercises to be too difficult or if you experience pain. Remember to exercise within your pain-free zone. If the full movement hurts, back off a little and perform the movement at a comfortable level. If you experience muscle soreness, refrain from exercising and apply a cold pack over the sore area for 10 to 15 minutes, 4 times a day for the first 24 to 48 hours. Then, for the following 24 hours, apply a heating pad for 10 to 15 minutes, 4 times a day. After this time period, you can gradually resume your exercise routine. You may want to work out at the low functioning level if you are severely affected by Gaucher disease. For example, if you have severe osteoporosis, joint stiffness, 1 or more joint replacements, or compression fractures. Also, if you need assistance to bathe or dress. Remember, you may feel a little tired in the beginning because you will be stretching and strengthening muscles that haven't been used all the time. Please stick with the program. You will feel more energetic and have more stamina. Take rest periods when you need them, and most important, have fun. Okay, let's get started. Let's start our exercise routine with a simple warm-up. A warm-up is an exercise or a group of exercises that actually get the body to the point where it feels warm. Hence, the name warm-up. This warmth is an increase in blood circulation throughout the muscles and body. It prepares the body for the exercise routine, potentially preventing any chances of muscle, tendon, ligament, and joint injuries. During and after the warm-up, you may also feel your heart rate increase. Don't worry, this is normal. There are various warm-up exercises. Just follow your level. We will do 20 repetitions. If you find that 20 is too much, decrease your repetitions to 5 to 10. Let's get started. Lenny Van Pelt is going to join us with the exercise program. All right, Lenny, let's get started. Okay. And this warm-up is actually working on the arms as well as the legs. It's working on some biceps as well as the quadriceps, the front of the thighs. And we're going to count together, and it's 1, 1 and 2, 2 and 3, 3 and 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, 10, 10 more, 1 and 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, and 10. Now let's take our pulse. Feel for the thumping of your heart, and what we're going to do is take our radial pulse. Use your index and middle finger and put it on your wrist, the thumb side. Next, count the thumps in a 10-second interval. Ready? Go! Take the number you counted and multiply by 6. If you have just found your heart rate, please stay within your target heart rate. Keep checking your pulse to ensure you're within your target heart rate. You can obtain your target heart rate by using this formula. 220 minus your age times 0.75. For example, if you are 20 years old, the formula would be 220 minus 20 multiplied by 0.75 equals 150 beats per minute. The next low-functioning warm-up is punching, and we're going to sit at the edge of the chair, and let's get started, Lenny. And it's 1, 1 and 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, 10, and it's 1, 1 and 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, and 10. Just a reminder, after each warm-up exercise, you may want to check your pulse. Okay, and Lenny, let's just move our legs just a little bit. All we're doing is sitting at the edge of the chair, and we're moving our legs just a minute amount. And we're going to get started right now, and it's 1 and 1 and 2 and 2 and 3, 3, and 4, 4, 5, 5, and 6, 6, and 7, 7, and 8, 8, 9, 9, 10, and 10, and 1, 1, and 2, 2, and 3, 3, and 4, 4, and 5, 5, and 6, 6, 7, 7, 8, 8, 9, 9, and 10, and 10. You may feel that a little bit in the back of the legs. You're working on the hamstrings, which are in the back of the legs. You may feel a little bit in your hip joints as well, but just go within your movement. Okay, the fourth low-functioning warm-up is ankle pumps. And it's on the balls of the feet and rock, and 2, and rock, 3, rock, and 4, rock, 5, and 6, and 7, and 8, and 9, 10, 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10. Now that was great because that's working on the calf muscles as well as the shins. That was wonderful. This warm-up is actually working on the arms. Now we're using a stick or a cane, or you can use a dowel or a yardstick. All right, and we're going to just bring the arms just up to shoulder height or a little below shoulder height. Ready, Lenny? And let's go. And it's 1, and down, and 2, down, 3, and down, 4, down, 5, down, 6, down, 7, down, 8, down, 9, down, 10, and down. Repeat. 1, and down, 2, down, 3, down, 4, down, 5, down, 6, down, 7, down, 8, down, 9, down, and 10, and down. And you may feel that in your upper back as well.
Like Suzanne, I was diagnosed late in life, and I know how devastating Gaucher disease can be. But there is one thing we can do to battle this disease, and that is exercise, because you can do it anywhere.
Now we'll do a stretching routine. This stretching will help joint function and joint range of motion. Range of motion is actually moving a joint throughout its available pain-free movement. Proper stretching emphasizes elongation of the muscles, tendons, and ligaments. This should ultimately result in an increase in your joint range of motion. Gently hold the stretch position for 3 to 5 seconds and do not bounce. I recommend 10 to 15 repetitions. If it's too much, decrease your repetitions. Please follow your level. The next group of exercises will be stretching the neck muscles. And the neck areas are very delicate, so we're going to do them nice and slowly. We're going to do 5 repetitions throughout each motion. And let's get started. Let's turn our head to the left and then to the right. All right, count with me. All right, ready? And turn to the left. Hold the stretch. Hold, 2, 3, 4, and 5. Turn to the right now. Go within your motion. And it's hold, 2, 3, 4, 5. Turn again to the left and nice and slowly. And it's hold, 2, 3, 4, 5. Turn to the right again, nice and slowly. Hold, 2, 3, 4, 5. Again to the left. And hold, 2, 3, 4, 5. And again to the right. Hold, 2, 3, 4, and 5. And we have 2 more to do. And it's hold, 2, 3, 4, 5. And gently to the right again. And it's hold, 2, 3, 4, 5. And 1 more. Hope you're not getting dizzy. And it's hold, 2, 3, 4, and 5. 1 more. To the right, gently. And it's hold, 2, 3, 4, and 5. Now we're going to bring our chin down. Hold it there. Hold, 2, 3, 4, 5, and all the way back, and feel the stretch. Hold, 2, 3, 4, and 5, and gently down, as far down as you can go comfortably. Hold, 2, 3, 4, 5, and way up again. This is number 2. Hold, 2, 3, 4, and 5, and down again, and just to the point where you feel that stretch, and again, and just hold it there. Good, good, and way up again for a count of 5. Hold, 2, 3, 4, and 5, and we just have 2 more to do. Hold, 2, 3, 4, and 5, and way up to the point where you just feel a comfortable stretch, no pain, and 3, 4, 5, and 1 more, and it's down. Hold, 2, 3, 4, 5, way up, and it's hold, 2, 3, 4, and 5. Terrific. The last range of motion for the neck is head tilts. And we're going to bring the ear to the shoulder, not the shoulder to the ear. No cheating is allowed. All right, let's get started and count with me. So make certain that you breathe. And let's tilt. And it's tilt, hold, 2, 3, 4, and 5. Good. Tilt to the right, again within your pain-free zone. Hold, 2, 3, 4, and 5. Good. And it's 3, 2, 3, 4, and 5. Gently tilt to the right again, and it's hold, 2, 3, 4, and 5. We're at the 4th one. Be patient. Feel that stretch. Hold, 2, 3, 4, and 5, and tilt and hold, 2, 3, 4, and 5. How about one more? And it's tilt, hold, 2, 3, 4, and 5. Feel that stretch right here. Hold, 2, 3, 4, and 5. That was wonderful. The next stretching exercise will be stretching the shoulders. For those of you who have shoulder replacements or perhaps some arthritis in the shoulders, you may feel some pain. Again, go within the pain-free zone. Using a cane, a dowel, or a yardstick, what we're going to do is go to the point where you feel the stretch and hold it there for 3 to 5 seconds. The other thing is, one shoulder may go higher than the other. Just go again to the point where you feel a comfortable stretch and no more than that. All right, let's get started. And it's up, go to the point, and here we are right there. Oh, I feel it. And it's hold, 2, 3, 4, and 5, and slowly down. Very good. Loose grip. And the elbows nice and loose as well. All right, and way up until you feel that stretch. Oh, I feel it, and it's a hold, 2, 3, 4, and 5. Wow, no pain. And Lenny, I'm sure you don't have any pain either, do you? And it's up there. Let's hold it there. Hold, 2, 3, 4, and 5. Good. And again, let's get up, way up, 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 up. Good, and hold it there. 2, 3, 4, and 5. Good. All right, ready? And let's get up there and hold, 2, 3, 4, and 5. That was wonderful. The third exercise is stretching the back of the shoulder. So you're going to feel a wonderful stretch right over here. The major thing here is that what you want to do is with the opposite hand, hold on to the back of your upper arm on the opposite side. So it's right over here. And what we want to do is just push the arm way over until you feel a comfortable stretch. No pain. You don't want to go high. I don't want to see this. I want to see down below. So it's over the chest. All right, so are we ready? Yes, we are. Let's get started here. Okay, and then pull across and hold the stretch. Hold, 2, 3, 4, and 5. And let's alternate for this. And again, grab the upper arm. Good, Lenny. And reach across. Hold, 2, 3, 4, and 5. And we're going to alternate again. Hold, 2, 3, 4, and 5. And again. And pull across. Hold, 2, 3, 4, and 5. Again, pull across, hold, 2, 3, 4, and 5. And the right arm, pull, feel the stretch, and it's 3, 4, and 5. And let's go for the 5th one. And it's over and across, hold, 2, 3, 4, and 5. And pull across, hold, 2, 3, 4, and 5. The next exercise is stretching the front of the shoulders. And what anybody with shoulder replacements or some arthritis of the shoulders, you may feel the stretch right away. You're going to hold on to a cane or a dowel, and what we're going to do is just hold on with a loose grip behind our back. And what we're going to do is just bring the arms back just a little bit until we feel that stretch. As we're doing this, keep your palms nice and loose. Don't clench the pole too tight. Keep the elbows loose as well. Let's bring the arms back just a little bit. Hold that stretch. Hold. 2, 3, 4, and 5. Okay, relax. Good. Let's count together. Push back. Hold. 2, 3, 4, and 5. Terrific. Good. We're going to do 3 more. We'll do 5 of these. Push back. Hold. 2, 3, 4, and 5. Terrific. And again. Hold. 2, 3, 4, and 5. Wonderful. And one more. Push back. Hold. 2, 3, 4, and 5. That was wonderful. The next group of exercises are going to be stretching out the lower back muscles. And this would be for low functioning. I'm going to be lying down with a pillow for my head for comfort and a pillow underneath my lower back. And anybody with hip replacements, just make certain that you do not go past at 90 degrees. All right, so what I'm going to do, I'm going to gently bring my right leg up. I'm going to hold it there. Hold. 2, 3, 4, and 5. And bring the left leg up. Hold. 2, 3, 4, and 5. And the right leg up again. I like to alternate. Hold. 2, 3, 4, and 5, and the left leg again. Hold. 2, 3, 4, and 5. And now the right leg. Hold. 2, 3, 4, and 5. I feel that stretch right in my lower back and my hips as well. Hold. 2, 3, 4, and 5. The right again. This is number 4. We're going to do 5. Hold. 2, 3, 4, and 5. And the left. Hold. 2, 3, 4, and 5. And the right leg. Hold. 2, 3, 4, and 5. And now the left again. Hold. 2, 3, 4, and 5. That was wonderful. The next group of exercises are for low functioning. And what we're doing is stretching the frontal portion of the body. So that would be the hip flexors, which are right here, and also the stomach muscles. All right, again, this is low functioning. We're standing. And the knees are slightly bent, hands on our pelvis or the hips. And what we're going to do is just arch our back until we just feel just a gentle stretch. And again, we may feel it right over here or in the stomach muscles. And let's hold it. Hold. 2, 3, 4, and 5. And we're going to do 5 repetitions. And again, just tilt back just a little bit. Hold. 2, 3, 4, and 5. And we're going to do 3. And I'm going to show you, if you're all daring, you can do this and bring your head back until you feel more of a stretch. Hold. 2, 3, 4, 5. And we'll do 2 more just like that. So again, if you're daring, push back and just feel the stretch. Hold. 2, 3, 4, 5. A reminder, breathe with me. Count out loud. Get that oxygen in. And tilt back. Hold. 2, 3, 4, and 5. That was terrific. The next group of exercises are going to stretch the hamstrings. That's the back of the thigh. And these are for low functioning. So what I'm going to do, I'm going to lie down on my back, pillow underneath my head for comfort. Roughly 3, 4 pillows underneath your calves. I have 3 fluffy pillows, and they're underneath my calves. And I'm going to lie down on my back. All I'm going to do is tighten my thighs. As I do so, I'm going to flex my feet up. I'm going to feel the stretch in the back of my calves as well as my hamstrings, because actually, again, this is a hamstring stretch. I'm going to hold it there, hold, 2, 3, and then I'm relaxing. And I'm going to flex my feet up as I tighten my thighs. Hold, 2, 3, and relax. I'm going to do 3 more. I'm going to tighten my thighs. I'm going to flex my feet up. Hold, 2, 3, and relax. I'm going to do it again. I'm going to tense my thighs, flex my feet, and I'm going to hold, 2, 3, and relax. I'm going to do 1 more. I'm going to tense my thighs, and I'm going to flex my feet up. Hold, 2, 3, and relax. The next group of exercises are for low functioning, stretching the calf muscle. We're going to stretch out the long calf muscle, and we're going to also stretch out a very short calf muscle attached to the Achilles tendon. So the first one is in the sitting position, and what we're going to do is extend our knee out. And we're going to now flex the foot. As we do so, we're going to try to get the toes to the nose, and we're going to feel that stretch. Hold it there. Hold, 2, 3, 4, and 5. Good. And now we're stretching out the short muscle. So we're going to bend the knee, and we're going to bend the knee to the point where it's 90 degrees. All right, so if you can get your knee bent like that, just to 90 degrees, just bring the toes to the nose again. All right, feel that stretch. Hold, 2, 3, and then down. Now let's extend the leg out again. Knee is straight. Get the toes to the nose. The heel remains down, and feel the stretch in the calf. Hold, 2, 3, 4, and 5. Bend the knee, and if you can, get to 90 degrees. Get the heel down, the toes go up to the nose. Hold, 2, 3, 4, and 5. Wonderful. Let's do 2 more. Extend the leg out, get the heel down, the toes go to the nose. Keep that heel down and feel that stretch. Hold, 2, 3, 4, and 5, and we have just to bend that knee 90 degrees if you could. Again, breathe with me and count out loud. Hold, 2, 3, 4, and 5. Let's do 1 more with that left leg. Straighten it out, keep the heel down, toes to the nose. Hold, 2, 3, 4, and 5. Bend the knee just to 90 degrees, and now heel goes down, toes go up, and hold, 2, 3, 4, and 5. Terrific. Let's do the right leg now. Straighten it out, get the heel down, toes go up to the nose. Hold, 2, 3, 4, and 5. Bend the knee, and again, if you can get it to 90 degrees, that would be great. And just get the heel down, the toes come up. Hold, 2, 3, 4, and 5, and straighten that leg out. Good. Heel goes down, toes come up. Hold, 2, 3, 4, and 5. Good. Bend the knee. Heel goes down. Toes come up. Hold. 2, 3, 4, and 5. Let's do 3 more. Let's straighten it out. Good, Lenny. Heel down. Toes come up. Hold. 2, 3, 4, and 5. Bend the knee. 90 degrees. Heel down. Toes up. And hold. 2, 3, 4, and 5. It's so important to stretch these muscles, because these are great for walking. We need these muscles nice and flexible to get the proper stepping and the cadence. Hold, 2, 3, 4, and 5, and then bend the knee again, toes come up. Hold, 2, 3, 4, and 5. 1 more for that flexibility in that leg. Toes come up, heel down, 2, 3, 4, and 5. Terrific. 1 more with that knee bent. Heel down, toes up. Hold, 2, 3, 4, and 5. Terrific. Thank you very much. You completed your stretching exercises.
There's no doubt my quality of life has dramatically improved with exercise.
The next section is a strengthening routine. These exercises will help tone the body, increase your strength, and ultimately improve bone density. During toning and strengthening exercises, you need to be aware of your posture. Proper posture is the key for preventing back injury. Proper posture is when we hold our body straight. Imagine a straight line connecting your ears to your shoulders, shoulders to your hips. The first 4 exercises will emphasize postural strengthening. Please follow your level. You may notice throughout these strengthening exercises that I stress the contraction of the muscles for 3 to 5 seconds. For the purpose of this video, we've condensed a number of exercises. If you would like other examples, please refer to my exercise manual entitled Movement for Life. The first postural exercise is going to be working on the upper back muscles. So in the sitting position, our elbows are bent. All we're going to do is bring those elbows as far back as we can go, pinching the shoulder blades together. As we do so, we're going to feel a little bit maybe of a stretch in the front of the chest, but what we're going to feel is a contraction of the back muscles, the upper back muscles. And we're going to hold it for 3 seconds. Hold, 2, 3, and relax. Good. And let's pull back. Get those elbows back. Hold, 2, 3, and then relax. And pull back and hold, 2, 3, and relax. Count with me. We're going to do 3 more. Pull back, hold, 2, 3, and relax. Let's do 2 more. And pull back, hold, 2, 3, and relax. Let's do 1 more. And count with me. And hold, 2, 3, and relax. This exercise is so easy, and certainly we can do it in front of the TV or a computer, so we can do it definitely during our working hours. The next group of exercises are for strengthening the rotator cuff muscle, and it's for the rotation movement. Okay, this rotation movement really helps us brush our hair, blow dry our hair, and move our arm this way. So we're working on strengthening. So what we're going to do at the last part of the motion, we're going to hold it for 3-second count. So Lenny, keep your upper arm by your body, just like this. Elbows are bent. All we're going to do, and keep a loose grip. No weights. And this is low functioning. All we're doing is bringing those arms out. The forearms go out. And hold it. Hold. 2, 3. Good. Back in. Bring them out again. And hold. 2, 3. Good. And bring them out. Hold, 2, 3. Good. Bring them out. Hold, 2, 3. Good. Let's do 3 more, Lenny. Hold, 2, 3. Good. 2 more. Again, we're working on that major muscle group, the rotator cuff muscles. Hold, 2, 3. Wonderful. Let's do 1 more. And feel that contraction. Hold, 2, 3. And that's wonderful. The next exercise is for working on the deltoids, and these are the muscle groups right along the shoulders right here. And this would be for low functioning, so we're not going to use any weights. What I'd like you to do is just make a fist. So you're going to clench your hands like this. The arms are right by your sides, alongside your thighs. And what we're going to do is bring our arms up on an angle. It's about a 45-degree angle, but we're going to go below our shoulder height. Okay, so you don't want to go too far up. All right, you're going to incur some problems, and again, I use that terminology, rotator cuff, but again, it's right by that particular shoulder, which is very sensitive. So we have sensitive tendons and ligaments. So you want to go right below your shoulder height. So 45-degree angle. So we're going to go up and down. Good. And come up and down. Now, for low functioning, if you feel that this is too easy, use a 1-pound weight. That would be fine. And come up again, hold, 2, 3, and then down, and come up, and hold, 2, 3, and down. And let's do 5 more. Up, hold, 2, 3, and down. Good. And back up again. Hold, 2, 3, and down. This is great for your posture. Hold, 2, 3, and down. Good, Lenny. And up again. Hold, 2, 3, and down. Let's do 2 more. And up again. Hold, 2, 3, and down. The elbows are slightly bent. Hold, 2, 3, and down. Very good. Next, we're going to work on upper back muscles. So holding on to the bar or cane, and we're going to push out and then back down. And then push out. So we're accentuating the pushing out as if we're doing a push-up. all right? But this is nice and easy, so just push out. Good. And feel that wonderful contraction in the upper back muscles. Good. And down. And again, push out. Wonderful. And down. Very good. And push out. And down. Let's do 3 more. And push out. And down. And push out. And down. Let's do 2 more. Push out. Good. And down. Let's do 1 more. And push out and down. Wonderful. Next exercise is working on the triceps, and that's back here, all right? A lot of people are having problems with strengthening those muscles. This is for low functioning. So what we're going to do is just touch the opposite shoulder, extend our arms straight out. Now, this is low functioning. If you want to use a 1-pound weight, that's fine. But for those of you who find this a little bit maybe trying, certainly can just make a fist. And as we extend, let's hold it there. Hold, 2, 3, and then back to the opposite shoulder. And extend out. Hold, 2, 3, good. And touch the opposite shoulder. And extend out. Hold, 2, 3, and touch the opposite shoulder. As you do so, when we're holding it, just feel the tension in that tricep area. Hold, 2, 3, and touch. Good. 1 more. And extend out. Hold, 2, 3, and relax. Good. Let's do the opposite. So touch the opposite shoulder and extend out. Feel the tension. Hold, 2, 3, and touch the opposite shoulder. Extend out. Hold, 2, 3. Good. Touch. And reach out, extend, use those triceps. Hold, 2, 3, and then touch, and then reach out again. Hold, 2, 3, beautiful. And touch, and then reach out again. Hold, 2, 3, good. And 1 more, touch, and extend right out. Hold, 2, 3. And now this is low functioning biceps, working on right over here, these muscle groups right here. Hold on to your cane. And we'll do this in a standing position, and we're going to go up and then back down. And flex the biceps, good, and down, and up, and down, good, and 3, and down, and 4, and down, 5, and down. We'll do 10, 6, and down, and 7, down, 8, down, 9, down, 10, and down. That was wonderful. The next exercise is working on the stomach muscles. And what we're doing is low functioning. So I have a pillow for my head and a pillow for my lower back. My knees are bent to support the back. And for any modified sit-up, you're going to feel a little bit in your neck muscles. All right, so what we're going to do is place our hands on our thighs, and we're going to slowly reach for the knees as we come up. And hold, 2, 3, and then come back down. And as we come up, we're going to count out loud. So remember, you have to breathe. All right, so we're going to come up, reach for the knees, hold, 2, 3, and then come back down. Now, I feel it in my stomach. I don't feel it in my neck, but for those of you who are just starting out, again, you're going to feel it in your neck muscles. And come up, hold, 2, 3, and then go back down nice and slowly. And do 2 more. And up, hold, 2, 3, and then come back down. And 1 more, and count with me. And hold, 2, 3, and then go back down. Good. These exercises are going to be working on the buttock muscles, the lower back, the quadriceps, which are here, and the hamstrings. And they're on your back. So you're going to go onto your back with your knees bent. We're going to do low functioning. And what it is, you want to work on trying to get the buttocks up off of the bed. All right. So all it is lifting up just a little bit. As you do so, squeeze your buttocks together. So squeeze, hold, 2, 3, and then relax. All right, and come up just a little bit. Hold, 2, 3, and then relax. All right, let's do it again. And lift those buttocks up just a little bit. Hold, 2, 3, and down. Let's do 5 more. And up, hold, 2, 3, and down. And up again, hold, 2, 3, and down. and up again. Hold, 2, 3, and down. Feel the squeeze. Hold, 2, 3, and down. This is great again for your back muscles, the buttocks, the hamstrings, and the quadriceps. Hold, 2, 3, and relax. Good. In these exercises, Lenny will be working on the quadricep muscles, and those are the major muscles for walking on level surface and stairs. He's leaning back, and what he's going to do is actually work on just a small range of motion. So Lenny, just straighten out your right knee. Good. And again, it's just the knee that's working. It's quadriceps, straightening the knee, not lifting the whole leg up. Hold, 2, 3, and back down. The left leg up. Hold, 2, 3, and down. And again with the right. Hold, 2, 3, and down. Good. Left leg. Hold, 2, 3, and down. One more with the right leg. Hold, 2, 3, and down. Left leg up. Hold, 2, 3, and down. Wonderful. Now both legs together, Lenny, and up. Hold, 2, 3, and down. You can see the contraction of the quadriceps, and up. Hold, 2, 3, and down. Do 2 more, Lenny. Up. Hold, 2, 3, and down. And again. Hold, 2, 3, and down. Terrific. All right, the next exercise, working on the outer hip muscles. These are really good exercises for strengthening the major muscle groups for anybody who's had hip problems or hip replacements. And this is going to be low and moderate functioning. So I'm going to show you the low functioning first. We're going to stand, and the major thing here is that you want to make certain that you're standing nice and straight. No tilting of the body. We're using pillows, so this way we're going to stand nice and straight and nice and tall. And what Lenny and I are going to do, and everyone else, is we're going to start with the left leg. So this is low functioning. We're just going to bring the leg out just a little bit and then back in. Let's do 5 on the left and then 5 on the right. All right, so we're going to go out. So it's 1 and down, and 2 and down, 3 and down. Good. 4 and down, and 1 more. 5 and down. Now the right leg, and again, you want to go a small arc. 1, a little bit less than that. 2, good. 3, 4, and 1 more, and 5. Now the left leg again, and we're going to just do 5 more, and it's just a little bit. 1 and down, 2 and down, 3 and down, 4 and down, 5 and down. Most of you would feel this right away. And 1 and 2 and 3, good. And 4, and 1 more, and 5. The last exercise in the strengthening program is working on the calf muscles. All right, so that we're working on right down here, and this would be for low functioning. So we're going to stand up, make certain that our body's nice and tall. We're not going to lean forward at all. Legs are apart, shoulder width, and all we're going to do is gently rock on the balls of the feet and then back down. And the balls of the feet and back down, nice and slowly. Now again, this is low functioning. So really, if you have to lean on your walker, perhaps your cane, or maybe the counter, kitchen counter, don't worry about if you have to lean on it. Just the major thing here is that you really want to use those calf muscles. This is a great way to work on bone density for the legs. And what you want to do is work on those calf muscles. Wonderful way to do it. Good, and we're going to just do 3 more, up, good, and down, and 2 more, up, and down, and just 1 more, up, and down. Terrific.
Well, in my opinion, I believe the combination of enzyme replacement therapy and exercise is the key in dealing with Gaucher disease.
The next section is an aerobic exercise routine. Aerobic exercises help to increase blood circulation, increase energy, and increase the oxygen supply throughout the body. Always check your pulse following the aerobic exercises. Remember to stay within your target heart rate. For beginners, start 5 minutes 3 times a week. Then in 2 weeks, increase your time to 10 minutes. Then in 4 weeks, increase your time to 20 minutes. Follow your level throughout this aerobic workout. We're working on aerobic exercise, And these are going to be for low functioning. Actually, I'm going to be walking along this table. I'm using the table as an assistance, all right? What you may want to use is your kitchen counter, your bureau, you know, in your bedroom, but basically you want to hold on to something. So I'm walking forward, I'm holding on, and I'm going to walk backwards. So again, this is aerobic, and also it's working on my walking technique. So again, I'm just walking forward and backwards. And again, I'm needing that assistance to hold on. Good, and then walk back. Good. I'm going to just do 2 more. I'm going to walk forward, hold on, good, and then walk backwards. All right, and 1 more walking forward, and then I'm going to walk backwards. Okay, good. What we're going to do is upper body. We're going to reach on our diagonal. We're going to do 10 of them. And it's 1, and reach, and 2, and reach, 3, and reach, and 4, and reach, 5, and reach, 6, and reach, 7, and reach, 8, reach, 9, reach, and 10, and reach. Very good. All right, this is the next low-functioning aerobic exercise. What we're going to do is just bring our leg out as we bring our arms out. Again, it's just a little range of motion. So it's 1, and 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now the left leg, and it's 1, and 2, and 3, 4, 5, 6, 7, 8, 9, and 10. Good. And the last aerobic exercise for low functioning, we're going to march in place as we move our arms, all right? And again, you're going to have a little range of motion in the legs. We're going to come up just a little bit. So it's 1, and 1, and 2, and 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, and 10. Very good. Don't forget, take your pulse right after the aerobic workout. Thank you. Whoa, nice work. To end our program, let's perform gentle cool-down exercises. All right, Lenny, let's do shoulder shrugs. We're going to just bring our shoulders up nice and slowly and then back down. Good. Let's do 3 of those, and gently up. Good, and down. And 1 more, gently up. Good, and down. And we're going to breathe together. So what we're going to do, count out loud and just pull across. Hold, 2, 3. Let's just pull across again. Hold, 2, 3. And just pull across again. Hold, 2, 3. And pull, hold, 2, 3. 1 more, Lenny, and pull across. Hold, 2, 3. Pull across and hold, 2, 3. And push back. And then again, push back. Good. And again, push back. And 1 last cool down will be just a heel. So we're going to just plant the heel in the floor. Good. And then to the right and plant that heel in the floor. And just 2 more. Good. And now the right leg. Very nice. 1 more with the left. Beautiful. And 1 more with the right. Very nice.
The diagnosis of Gaucher disease is a long-term commitment, but we can start today to make a difference.
This concludes our total body program, Movement for Life. Remember, it may not be right away, but you should feel better and stronger. Keep drinking plenty of water and take breaks, even when you're not exercising. Thank you so much for letting me be your personal trainer, and keep up the good work.